Pledge of allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right. Do we have any new folks that have not been to a meeting before? We'd love to introduce you, find out a little bit about you. Everybody's been here before? All right. We have a sheet starting around, actually it's 2 or 3 sheets keeping together. That's not only our normal sign-in sheet, but there's other information we're asking from you tonight about the S.E.T. and what you are capable of doing, what equipment that you might bring. We are not suggesting that you bring the kitchen sink, the bathroom, and your garage with you. But we will know more as you will know more as the S.E.T. evolves. Has everyone at least had an opportunity to see what the scenario is on the Georgia ARES site? No. You have not? You're about to learn. So with this, we're going to, in a sense, go in character and start our briefing. Consider that we are learning as if we will be participating in an actual event. I will start simulating the incident commander. We have the safety officer, Mike. We have the finance section chief, Dennis. I know you were the subject matter expert, as well as Dorothy is going to be the PIO. David, the operations chief. The planning chief is going to be Hal. Did I leave out anyone? Logistics chief.
Where's logistics?
So, let's get started. There has been a confirmed breakout of the pneumonic plague in Georgia. Do you know about pneumonic plague and what the difference is? Many of you may have heard of bubonic plague. This is different, and we'll find out. We'll have our PIO explain a little bit more about that in just a moment. The plague has broken out in areas of Georgia surrounding us. The CDC has been notified. Epidemiologists have begun an investigation. We have numerous patients presenting with plague-like symptoms at various emergency rooms throughout the region. As the media gets hold of the story, there may be mass panic. In this situation, the county public health offices won't be able to keep up with the volume of requests and patients. Healthcare facilities will be overwhelmed. The governor will most likely declare a state of emergency, and medical facilities implement their emergency surge plans. As plans are put into action, there are several areas where additional communications capabilities will be required. Some hospitals will set up off-site triage locations. Transfer patients to alternate care sites. In coordination with public health officials, some will implement points of dispensing or points of distribution. They are both called pods, but we will differentiate between a point of dispensing and a point of distribution. All will need to coordinate supplies that will be scarce and a possible combination of the above. Who do we turn over to first?
I guess we'll go to Dorothy.
Okay. First to provide more information will be our PIO.
Plague. You gotta tear his head off.
Oh my God.
She made a PowerPoint? You didn't tell me to make a PowerPoint.
Let's dim the lights. Can we dim the lights a little bit?
Yeah, so Dorothy's playing 2 roles today. She's our information officer as well as our subject matter expert.
A SME.
A SME.
Down left, right. There you go. Yeah, I'm very subtle with my names.
I like the pocket. It's just too big.
Okay. Oh, that's fine. All right, so just a situation update. What is plague, what kind of symptoms, and what the public health response will be. Too many words on this, but plague is life-threatening. You've heard of plague in terms of the Black Death back in the 14th century. It's been around forever. It's mostly from rats and flea infestation, so now it's kind of rare, which makes us wonder how it got here. Being in bioterrorism and emergency preparedness, when we hear multiple cases of plague, we immediately think that somebody's helped it along. So there'll be a lot of security involved, because if there's a serious plague outbreak, it's probably man-created. There are 3 types of plague. You've heard of bubonic, septicemic, and pneumonic. Bubonic, those are the 3 names. The signs and the symptoms are a little bit different, and the really bad news is you can have more than one at the same time. So plague is the gift that keeps on giving. The bubonic plague, that's the one we've mostly heard of. That's from the bites, the little rat bites and the flea bites. There's a little girl in Colorado right now that's suffering from it. There was a dead squirrel and her mom said stay away from it, and she didn't, and she's got bubonic plague. And that's headaches and fever and chills and that sort of thing. Septicemic is really bad, because that's the black plague. That's where you get necrotic and everything dies and everything turns black and icky and nasty. It's from having too much plague in too much of the plague bacteria in your blood system, so it kills off your body. Pneumonic is the one we're dealing with right now. It's in the lungs. And our initial patient showed up looking like he had flu. He had fever, he felt crummy, he was weak, and he got very sick very quickly. You go into serious pneumonia, in 2 to 4 days you're dead. The thing with plague is that if you have bubonic plague, the bumps on your arms, you can actually inhale it and get it in your lungs. And if you get enough of it, you get the septicemic. So you can really have all 3 kinds at the same time. It's a nasty, nasty disease. It can be fixed with antibiotics, but you'd better get the antibiotics into the people within 1 day of them showing symptoms. So public health is going to be dancing the fast dance and trying to get as many people taken care of as possible. If you don't get the antibiotics into people within about a day, they probably won't make it. It's a fatal disease. It's not like the flu, where if you're fairly healthy, you'll get over it. Doesn't happen that way. So the biggest problem with plague is that it doesn't show up immediately. So you can be exposed on Monday, and you don't get sick until maybe Friday. Well, by Friday, goodness only knows where you've gone to, what kind of traveling you've done. So it spreads rather easily through, which is why we worry a lot about bioterrorism with it, because it can be made to be a weapon. And you get people started, and then they go travel, and then they spread it all over themselves. So, what would the public health response be? Public health would be in charge. They would be the ones that would set up the response. The Gwinnett County EOC would be helping, they would be supporting, they would be supplying security, more volunteers, anything that public health would need. But this EOC would be a support function of the public health EOC. So public health would set up a number of different types of response. They'd have a neighborhood emergency help center. That's a large building that will do a little bit of triage, get people maybe some first aid and a little bit of care until they can be transported to a hospital. It's also where the volunteer reception center would be for public health. So any of the volunteer functions and the administrative functions would be at the NEHC. A pod is a point of dispensing. That's where the medicine is given out. And John made the difference between dispensing and distribution. Distribution is usually groceries and water. Dispensing is drugs. So the Gwinnett EMA might set up a point of distribution if the grocery stores are shut down and stuff like that and people need water and groceries. But public health would set up a point of dispensing. In order to get the drugs that we would dispense, CDC would supply probably a 12-hour pushback, which is 50 tons of pharmaceuticals. It takes about 9 trucks. It's all pre-packed. It looks like that. It goes, if you're distanced from the location, it'll slide into a plane and they'll fly it. Being in Atlanta, as close to the CDC as we are, our guess, because they'll kill us if we tell the real story, is that it's probably closer than that. But there's 12 locations throughout the country, and nowhere in our country is further than 12 hours from this. It's got all sorts of medical supplies, and it's what you call on when you know things are bad, but you're not quite sure what you're going to need. When you do know what you're going to need, you'll probably just ask for it specifically, and that's vendor managed. The problem with that is you don't get all the stuff you don't need, but it takes about 3 days to get it, and if you've got people dropping all over the place, you're not going to do that. So all that material will show up. When you got a lot of people who need beds, probably not going to fit in the hospitals. So one of the federal assets that we would call for is a federal medical station. Takes a building about 40,000 square feet with heat and water and all sorts of supplies. Comes with about 25,000 beds and all of the medical supplies that we would need. So we may set up a federal medical station. I've lost a couple slides. Medications that we'll be using are streptomycin, and I thought it might help if you actually saw them printed. Gentamicin, doxycycline, which everybody calls doxy. It's a very common, very accepted shortening of the word. Ciprofloxacin, which for some strange reason people call Cipro, and chloramphenicol. So these are the terms you're going to be transmitting. Questions?
You say this federal center that you're going to be getting is 25,000 people?
No, it's comes in units of 5, and all told, it could be 25,000 beds.
That isn't much for the city of Gwinnett.
No, it's not. No, it's not.
Dropping the bucket.
It's a start, but you're right. It's nowhere near, and you probably would have to set up several of them. The problem is you need a 40,000 square foot building to set it up in, and there aren't that many of them around. So what'll happen is if the hospital is surged, the hospital will set up an ACC, an acute care center, where they'll put all the people who have plague so that you don't have to worry about them catching it from each other. Contagion stops being an issue, and they'll pull this in, and so the hospital will be overstocked, this will be overstocked, and we'll probably pull a couple of these in. There's several of them in the country. Yes?
What do we do for volunteers to make sure that they don't get it?
Well, first of all, you can prophylax. You can take the antibiotics in advance so that it'll keep you from getting sick. Second of all, I think our safety officer is going to talk about PPE, personal protective equipment that we would employ. So I don't want to step on him, but yeah, you'd use PPE and you'd take the medication. Yeah.
Are there acceptable abbreviations for any of these? The same
Well,
ASA?
Cipro
Well,
and
ASA
Doxy
is
are
aspirin.
totally acceptable.
Okay, but there's nothing short like ASA or, you know, like for aspirin?
No,
Okay,
no.
too bad.
Maybe whichever doctor requests it, you know, whoever our served agency is, if they request ASP, then that's what you're going to transmit. So maybe we'll get lucky and they'll have a heart.
Okay.
But Cipro and Doxy, I mean, a lot of professionals don't even know what those stand for because everybody trips over the words. Any other questions for me? Okay.
Switch to your PIO here.
I'm sorry. My what?
PIO.
Oh, you want me to state what I am? Oh, as the public. Yeah, it's right there. Oh, so you want me to read this?
Sure.
Okay. Whatever. As a public information officer, I am the conduit for information. I do not decide which information goes out. That's the incident commander's job. But I will be listening to what's coming in and reporting that to the incident commander, and then the incident commander will tell me what information I can let the media have. I develop the material that's used in briefings. I will get the incident commander's approval before the media releases. I inform the media and conduct the briefings. I'll do tours or delegate somebody to do tours and other interviews and any briefings that might be required. I'll get the media information in. PIO's job is as much to listen as it is to talk and to brief the incident commander, because usually you don't want the PIO doing the talking. You want some government official or somebody who's impressive, not the PIO. And then I'll maintain current information summaries of what's gone out and what's been said, so that people can't say, but you said. No, I didn't.
Can we talk to the media during this event, Dorothy?
Please don't talk to the media. Please send all media to
That's under
me.
briefing part.
I missed that, okay. Well, I've already said almost all of this. Okay. Yeah, all press questions should be referred to me. I mean, we talk about that all the time with NIMS training and everything. Don't talk to the media. They will trip you up. You're involved, your mindset is on doing your job, and they ask you a question from left field, and the reaction is to give them an answer, and it may not be the answer that we want necessarily to go out, because we're trying to contain the panic along with the plague. Okay. This is
And if you all remember the ICS structure, you know, the incident commander is usually at the top, and then the command staff is PIO, and we're going to have the safety officer come up next. We're not going to have a liaison officer for tonight, but so here's the safety officer.
Safety officer. The safety officer's function is to develop and recommend measures for assuring personal safety and to assess and/or anticipate hazardous and unsafe conditions. Only one safety officer will be assigned for each incident. The safety officer may have assistance as necessary, and the assistants may also represent assisting agencies or jurisdictions. Safety assistants may have specific responsibilities such as air operations, hazardous materials, etc. The responsibilities include participate in planning meetings, identify hazardous situations associated with the incident, review the incident action plan for safety implications, exercise emergency authority to stop and prevent unsafe acts, investigate accidents that have occurred within the incident area, and review and approve the medical plan. The briefing is working in an infectious environment can be unnerving. Being around this type of situation requires some precautions. Ensure you have sanitizing wipes and wipe down all, and underscore all, exposed equipment. Wear gloves when in direct contact with symptomatic patients. Wearing an N95 mask and glasses is a must, since many infectious agents are spread when droplets come into contact with mucous tissue. Avoid touching your face. Hand sanitizer is a good thing to carry and use. Each site, hospital, triage area, alternate care site, etc., should provide incoming personnel with the necessary personal protection equipment, or PPE, based on the current threat. Ensure you follow proper protocols for disposing of any PPE and any infection control procedures when leaving the site.
Any questions?
What was the number on the mask?
N-95, November -95.
Those have to do with the, I guess, the size of particulates they can get through. Yeah. Like a surgeon's mask wouldn't be enough.
On that N95 mask, if it's hot weather or something like that, and the mask gets wet or moisture in there, will that cut down the effectiveness of the mask?
Yes.
Just take it off and wipe your face off.
With the sanitizing wipe. Okay, we've got our, now we're getting into the general section. We got our operations section chief. He's going to come up and give his briefing.
I like all these little signs they have on here. Yeah, we're working on it. Action plan safety analysis.
Operations section. Section description. The operations section is tasked with directing all actions to meet the incident objective. It also activates and supervises organization elements in accordance with the incident action plan and directs execution. Section chief responsibility is manage the tactical operations, assist in development of the operation portion of the incident action plan, which looks like they've been working on here. Ensure safe tactical operations, request additional resources to support tactical operations. And who's the resource chief? The resource guy?
Logistics?
Logistics, yeah. And then approve release of resources from the assigned status. So I guess he works with the logistics guy to get that stuff. Tell him when he needs to release stuff. As this outbreak proceeds, we will be deploying teams to assist public health and hospitals. Public health will be establishing several types of field locations. Point of dispensing, PODs, PODs. Facilities will be established around the county to provide medication to the public for prevention and treatment for the plague. Neighborhood Emergency Health Centers, it was a very NEHC, will also be established to provide medical care for symptomatic patients as well as provide prevention and treatment. We will also be assisting as medical facility implement their emergency surge plans and set up acute care centers to handle overflow. Okay. Distribution and transportation of medications from undisclosed locations will be done on an as-needed basis. It'll be needed if everybody gets sick. Soon we'll be establishing a staging area for personnel, and we will have many volunteers from groups around Gwinnett to help with various aspects of this incident, such as search teams will assist the traffic control and transportation, the Medical Reserve Corps. Who's the Medical Reserve Corps?
It's a volunteer group.
Oh, yeah.
You got a big one? Okay.
300 people.
Volunteers will assist at the PODs and NEHC locations. Gwinnett ARES volunteers will provide communications between field locations, EOCs, and hospitals. And that's to come later, those will come later. Any questions? Okay.
Okay, Dennis? Yeah, I think your vest is green for Monday.
So now
time here at the Masters. Didn't play my best game, but I tried hard. Okay, I'm the section chief for finance and administration, and I would not necessarily be called out in every activation, only those in which there is some financial burden on our group itself. And my duties would fall generally into two categories. One of them is tracking, quite obviously, our finances, what the money is needed for, and what it should go to, and then I take care of getting funds dispersed, assuming there's anybody healthy enough to go to work at the bank. And the other thing is to track time records, check the hours that everybody has been on the job, and prepare a report for that for later on. And then take part in the debriefing after the incident is closed, particularly with regard to what our financial burden has been and what we contributed to the effort. As this outbreak proceeds, there may be a need to activate the finance section to assess what we're going to need and how to get the materials purchased and distributed to those that we need, and make projections and turn those in case we're going to get any financial help, do some cost analysis as to what is going to be required on our part. And that's the extent of my involvement.
Can you give an example?
Supplies, water, or food, in case those are not provided by some other agency, we'll have to be on the job, and if it runs into an extended period of deployment, we'll need to take care of that. Batteries, that sort of thing. Whatever comes up.
Thanks, Dennis. Okay, next is the planning section. Who's me? Basically, the planning section collects, evaluates, processes, and disseminates information for use at the incident. As section chief, my responsibilities would be to collect and process situation information about the incident, supervise preparation of the incident action plan. Are you all familiar with an incident action plan? That can be a single sheet of paper or a whole stack that usually the incident commander starts writing up as soon as an incident starts. It makes an easy way for him to pass it on to incident commander that replaces him, and it basically has all sorts of details about the incident and what's happened so far and the goals and what's going to happen. Other responsibilities would be to provide input to the incident commander and the operations section chief in preparing the incident action plan, reassigning out-of-service personnel already on site to ICS organizational positions, determine need for any specialized resources in support of the incident, like subject matter experts, things like that. They may bring in other people from outside the command structure that have specialties. Establish special information collection activities as necessary, such as weather, environmental, or toxics. Assemble information on alternative strategies. Provide periodic predictions on incident potential. Report any significant changes in incident status. Compile and display incident status information. Oversee preparation of the incident demobilization plan, which is kind of self-explanatory. That's when it's drawing to an end. You have to have another plan that would be the orderly demobilization of all the sections and the personnel. And also incorporate the incident traffic plan and other supporting plans into the IAP. Now the briefing part, we've been working closely with Gwinnett, Newton, Rockdale Health Department, GMA, and CDC, and regional coordinating hospitals in building the incident action plan and in deciding the best course of action to take as this outbreak continues. We will be establishing several units under the planning section to handle various tasks. We'll have the resources unit, which will be responsible for maintaining the status of all assigned resources, primary and support, at the incident through check-in procedures and deployment updates. We'll have the situation unit, which will be responsible for the collection, processing, and organizing of all incident information and for preparing future projections of incident growth, maps, and intelligence information. We'll have the documentation unit, will be responsible for the maintenance of accurate and up-to-date incident files, and the demobilization unit, which will be responsible for developing the incident demobilization plan. And one of the things about the ICS structure, all these additional units are only created if there's extra work on top of what the planning section chief could do. That way he creates the units below him to offload some of that task. And the same way goes for the whole ICS structure. If it's a real small incident, you might have an incident commander and no section chiefs or PIO or safety officer. Just depends on the size of the incident. Okay, next we have John, our logistics section chief. I got a copy up here too.
Okay.
Okay, you're probably all familiar with logistics, that is located and get it to the right place. So all the incident support needs are provided by the logistics section, with the exception of the aviation support, which is handled by a separate group called the Air Support Group in Air Operations. So we manage all the incident logistics, obviously working with the finance people to get the money and contact the vendors, find out who has what, how to get it there. Provide the logistical input to the incident commander in preparing the incident action plan, brief the branch directors and unit leaders as needed, anticipate known incident service and support requirements, and request and obtain additional resources as needed. We also review and provide input into the planning for communications, medical, and traffic. We supervise requests for additional resources and oversee demobilization of the logistics section, which is a big deal. One thing I was not actually on the incident, but there was an incident in Colorado called the Hayman Fire 10 years ago, and the incident lasted for 2.5 weeks. In an out-of-control fire on the west side of the Front Range. And you can imagine all of this kicked in. And it was really interesting how amateur radio played a part in that, because they were like the spider web that connected all the pieces together. They had a solar-powered repeater up on top of a mountain and hooked the whole thing together. Any questions?
Did you see the briefing part?
You want me to read that part too?
Yeah.
Sure. For this incident, we'll be establishing several units under the logistics section. The supply unit will be responsible for ordering, receiving, processing, and storing all incident-related resources. All off-incident resources will be ordered through the supply unit, including tactical and support resources, personnel, and expendable and non-expendable support supplies. Facilities unit will be responsible for setup, maintenance, and demobilization of all incident support facilities. Ground support unit is primarily responsible for the maintenance, service, and fueling of all mobile equipment and vehicles, with the exception of aviation resources. The unit also has responsibility for the ground transportation of personnel, supplies, and equipment, and the development of the incident traffic plan. One thing I learned in an EOC orientation coming up on 2 years ago was guess what section of Gwinnett County is involved in all this? School buses. And you can readily see how they could be utilized to move people and things around, because there's so many of them. One of the things that failed in the New Orleans Katrina. They didn't pull that off. The communications unit is responsible for developing plans for the use of incident communications equipment and facilities, installing testing of communications equipment, supervision of the incident communications center, the distribution and maintenance of communication equipment. Our Gwinnett ARES volunteers will be part of this unit. Food unit is responsible for supplying the food needs for the entire incident, including all remote locations, camp staging areas, as well as providing food for personnel unable to leave tactical field assignments. And the medical unit will provide medical aid for responders and volunteers.
Okay, so quick quiz. What does the incident commander do?
Use the bullet.
Tells everybody else.
Starts out doing everything, right? Until he gets too busy and then he's got to delegate some responsibility. What does the PIO do? Just make sure that the media gets the right story, more or less. How about the safety officer?
Make sure we don't do anything stupid.
Well, we can't prevent that, but yeah, that you don't get hurt doing something stupid. There you go. And then what are our 4 general staff positions? The sections?
Operations.
Planning, logistics, and finance administration. Okay. Now, do all incidents have those 4 sections?
No.
Okay. Why is that? Because it may be too small, or it might be at different points in the incident, before or after it needs it. Okay. Now, where does ARES fit into the structure?
We're the spider web that pulls it all together.
What part of logistics?
Communication.
Communications unit. There you go. Okay. And basically, one of the reasons we wanted to do a review of the incident command structure is, even though we're under the communications unit, there's a possibility we're going to be passing it between all these different parts of the ICS web. So we need to know what they do, and we wouldn't necessarily need to know how to route a message, because based on the 213 forms we're going to look at in a minute, it says who it's from, who it's to. You may just have to know, where that branch or that office would be located. Okay, now I'm going to play the part of the communications unit leader. And this would be under the logistics section as one of the units under there. The communications leader is responsible for developing plans for the effective use of incident communications equipment and facilities, installing, testing of communications equipment, supervision of the incident communications center, distribution of communications equipment to incident personnel, and maintenance and repair of communications equipment. They help prepare the incident radio communications plan, which is ICS Form 205, and ensure that the incident communications center and message center is established, establish appropriate communications distribution, ensure communication systems are installed and tested, ensure equipment accountability system is established so they'll know where the stuff is, ensure portable radio equipment from a cache is distributed per incident radio communications plan, provide technical information as required, on the adequacy of communication systems currently in operation, geographic limitations of communication systems, equipment capabilities and limitations, and amount and types of equipment available, and anticipated problems in the use of communications equipment. They also supervise communications unit activities, pretty obvious. Okay, briefing. We'll be using amateur radio for the majority of communications needs during this incident. We will be using UHF and VHF frequencies for voice and data traffic. We will be sending data using various digital modes. All communications will be sent using ICS 213 forms and procedures. As teams are deployed, frequencies will be assigned. Make sure all predetermined or predefined frequencies are loaded in your radios. Do y'all all have the current list of ARES frequencies programmed? Yeah? Okay. Because it changes occasionally, so you may want to check the Gwinnett ARES website to make sure you've got the current version. Right now, we're going to go take a quick look at the 213 forms. We looked at it a little bit already in the pre-training session. Okay. All right. Required somebody else's presentation on this. I think it's the Texas Amateur Radio Communications.
Let me just say, pay close attention to this because this is what you will be using.
Okay, so the reason we're using the 213 form is because that's what they use during ICS, in the ICS system. It wouldn't be the NTS form like we're used to, if anybody used to that. One of the important things is we're going to use plain English, where basically whatever the message says is what we're going to transmit. This is what the form looks like. It looks a lot like, how many of y'all were in the digital training session before? Okay, so you recognize a lot of these fields. We've got the to field, which would be who the message is going to. Not the amateur radio operator, but the incident commander or section chief or something like that. So it would have their name and their position title. And then right here it would have from, which is the person sending the message, another section chief or team leader or something like that, would have his name and his position. And then we have a subject right here, basically a short description of what the message is about. And, yeah.
How do you determine the message number? Is that given to you, or
Repeat the question.
Yeah. What we're going to do, we're going to have the message numbers pretty much pre-assigned so we can track them during the S.E.T. But normally most of the software can auto-generate them based on your location. So it'd be like number 1 message from this place or number 2 from this place.
Yeah, but if you got operators in multiple locations, how do you keep them?
Well, with FLDigi, the number is tied to your location. So you would have your own sequence of numbers, somebody else would have the same sequence for a different location. Yeah.
Location 2.
Yeah, for the S.E.T, we're probably going to have all the messages are going to be sequential. So no message will use the same number. Okay, of course you got your date and time, message area. This is the part that's one of the ones that's very important of being sure to put down exactly what the wording is. Don't abbreviate anything that wasn't already abbreviated or assume anything from it. The sender's signature block, in this case for the request, would be the from person. And I think over here it's got another position blank underneath there. And then that would be the message that you send across. We would send that over via voice or FLDigi or whatever mode we're using. And when it gets to the other side, you would see who it's to. And in a real scenario, you'd have that message sent over to that person, probably by foot, and get an answer back on the written form, and they would come back and you could transmit it back across. So that would go in the reply area. And then signature would be the to person, because that's the reply. Any questions about the basic format?
When you're sending a reply, you can just reference the message number and say this is a reply to message number.
It's automatic in FL Digi.
Yeah, the form after reply.
Yeah, what we're thinking about, or what I was thinking about doing
But I
is
mean, you're just
we can,
transmitting the reply you have to deal with all this.
over voice, correct. Over FL Digi, it's gonna transmit the whole thing, but you don't have to type it all in again. What I was thinking is that we could basically, you know, with the numbers that we've generated for the S.E.T, we put those in the subject field. Just so we'd have the paperwork afterwards and we could reference those and see how accurate we were. Earl?
This implies that we need to be able to print that form on site wherever location we have to do it. Is that correct? So we need a printer and all that.
Well, if you're to place, let's say the FLDG computers do not work, and you have to do this by voice, should you limit the message area to so many words and so forth, or should you just do a complete thing regardless of the amount of words that you're so told to send?
Yeah, I guess the spec is that it's like 10 or 5 lines of 10 lines of 5 words, but we're not going to be doing that during the S.E.T. You know, if we're sending,
isn't it whatever the serving agency gives us is what we need to send?
Yeah.
But remember, they're going to supposedly be trained on these as well, so they will try to adhere to the standards of the form.
Yeah. If we're sending lists of, you know, drugs or lists of personnel or something like that, we probably won't use a 213 form. We'll just use a flat file format. Any more questions about the general format of the 213?
You're saying that the message number generated by FL Digi is the one over in this area going to be generating one, and you've got a remote site that's going to be generating a list of 1 through 10 also?
If you use FL Digi's message numbers.
We got multiple messages of number 1 from each site, number 2 from each site. That looks to be like the point of real confusion.
Yeah, like I'm saying, that's the way FL Digi does it, just because there's no other feature between them. Yeah.
That is from FL Message, determines the number, it automatically assigns it, uses call sign, serial number, or date and time. So if you want to get rid of those in FL Message, when we're sending the 213 back and forth, or any other message, then we need to disable those functions in FL Message. Otherwise, we have them all checked and use call sign, which is the NRG or Eastside Hospital, or wherever they're at. And the serial number, which FL Message will increment for each one that they generate. Now, if it's a response to the other one, it uses that one, it goes back as a response, which has the original message in it.
If you happen to be transmitting by voice, which some of these messages will, just the number will be pre-assigned that you will be handed. So if you're replying to that, you are replying to message 204 when you send that reply by voice.
And in a real deployment, we can do things like pre-assign different locations, different ranges of message IDs, just so we don't have any overlap. Steve?
If by chance we are one of the people using voice, are we going to send the message and then request feedback, or to make, what is the error correction method on using voice for this exercise?
We'll get into that. It's got a whole section of the correct procedure for requesting fills or things. Is that what you're asking about? Yeah.
Okay.
Yeah.
I got 2 questions. First, more an observation. A very deterministic way of managing the messages, if you can extend for weeks at a time, is the originator and the date time group.
Yeah.
I mean, the message numbers are going to get out of control real quickly. Second, once you've got one of these printed forms, who's responsible for archiving the forms?
Usually in a real situation, they would be carbon copy forms. If you're actually, I guess the ones they would actually have in an ICS kit would be carbon copy forms. You know, since we're printing them out, we can print out multiple copies instead of having to do carbon copies or trying to feed it through a dot matrix printer or something like that.
Yeah. Okay.
Does that answer your question?
Pretty much. Who all gets copies then? The station, the recipient?
I know the amateur radio station would keep one, and then
If you have a form that gives you the opportunity to keep a copy, yes, but remember, we're the pipe. The main thing is that the originating party and the replying party are the ones that are keeping the messages. I would suggest that you log, whether you're using an NTS form or in this case now an ICS form, you should want to keep a local log of your traffic, of your transmissions in and out.
If we're
at your
using
station.
RAP, it automatically keeps a RAP file on your PC, so you'll always have a copy on your PC in the RAP folder.
I would keep a hard copy. I would keep a written log as well, just for practice here.
So John, are we expecting them to have printers at all these sites where we're going to deliver messages to serve the agency?
If you don't, you have to hand transcribe the message. If you have a printer, fine, but if you're sending it by voice, what are you going to do?
Scratch it and
You're going to be writing it out. So don't write like a doctor, write legibly.
Okay.
Will you be seeing, somebody should make sure that at least one person per site knows how to write legibly?
That's not one of the check marks on the little sign-in sheet. just practice between now and the S.E.T. Okay?
You're going to read the sign-in sheet to figure out who can write legibly.
Good point. Okay.
If you have a laptop and you're taking it by a voice, can you just type it in and print it?
Yes, sure.
If you have a printer.
Yeah.
And if you can type fast enough.
I can type fast enough, right?
Voice recognition or email.
If all else fails, go back to the least common denominator, pen or pencil and paper.
And somebody calls scribe because you're busy, you use your scribe to sit there and write.
Another thing to remember on this, go out and get blank copies of ICS 213 forms in case you have to hand write. And the obvious question might be, where do I find those? Be creative.
Yeah.
I'm sure enterprising amateur radio operators can find them.
Okay, basic submission message handling. It's important that you get it 100% accurate. So when you're receiving a message, hopefully the person will be speaking at writing speed, going slowly, pauses occasionally to make sure you've got everything so far. Because the important thing is, you want to get it there accurately, and you only want to send it once. You don't want to have to keep on, repeating it.
How many of you have sent NTS messages on HF? That's scary.
How many years ago were you looking for this?
Hey, they're doing it every night on the nets. So I think that the key thing there is speak clearly and speak at writing speed.
Write it as you send it, that way you get it at the right speed.
That's one of the nets I always say slowly, alphabetically.
How many people heard K4HBI when he checks into the net, he speaks very slow so that you can copy every word that he says? Is that too fast?
Yeah. Okay. I thought that was just an Alabama thing.
Okay. Next, these are some methods for getting repeats of certain areas. Receiver could ask for all after or all before, different terminology like that.
If you miss something.
Yeah, if you're interested in these rules for doing 213 forms, I found about 3 or 4 presentations on the internet about them. So do some Googling, and you'll find pretty much the same rules for all of them. Say exactly what the message is. Don't paraphrase it. Spell similar sounding or complex words. Like to, to, or to. You can use phonetics for those. Practice with the tape recorder.
What's that mean with procedural words that you speak? I didn't know what that meant.
They got more about procedural words on the next one. Yeah, so just to verify, when you're follows as you start doing the message. Not always necessary, but it can make things a little bit clearer and a little bit easier for the other person to recognize, okay, here comes the message. It's not another part of the subject or something like that. Let's see. I guess there are parts where you can use break to, I guess usually they do that for periods, don't they?
No,
At the end of sentences?
X-ray.
Yeah. If you're doing numbers, you can use the word figures and then the digits afterwards. So somebody doesn't try to write it out, instead they write it as a number. Initial for single letters. And you need to spell something, use phonetics. And I guess for, if you have a grouping of letters, like a license plate number or something that you got to transmit, you may have a letter group, number group, or mixed group. Make it a little easier for them to understand what's coming next. Any questions about that? Guys, again, if you're repeating something, query for a question, decimal, period, or comma for punctuation. And again, we're not, it'd be nice to practice this some. We're not going to ding you if we don't hear you saying them on the radio. But may make it easier to do some of these 213s. You can say john@smith.net or @symbols. And phonetics for mixed groupings like call signs. And when you're done with your current message, or and more if you've got another message to come after that.
Or in no more.
And no more. Okay. So yeah, go do some Googling on ICS 213s. Just be ready to use them for the S.E.T. Accuracy is important. Use plain English or whatever message they give you. If it's a drug name and it doesn't sound like English, use it anyway. Accuracy and keep your paper copies. Keep them some kind of order in case you go back and look for them later. And practice. And we don't have a sample practice message test tonight. Aren't you all interested? Okay, so any questions about the 213 forms? When are we going to use them?
All the time, most of the time.
At the S.E.T, okay. Either via voice or over FLDigi, so, okay.
All right, that kind of ends our formal part and the some instruction on the 213 form. Now, would you be exposed to that entire briefing by all the different section chiefs normally? No, but we wanted to give you a flavor of that tonight. Who would you be receiving? Who would be the lowest person in the hierarchy that you would be receiving instructions from?
Logistics?
Comm-unit leader. Comm-unit leader is under what? Logistics. Now, who would ask logistics for operators? No. Not any one of the section chiefs, but more than likely it would be the operations chief, because they're tasked with the overall daily operation plan. All right, Now let's talk a little bit about what we're going to do. We're not going to be 100% specific on the information tonight, but that information will evolve during next week. Like some of you that have participated in previous S.E.Ts, to add some level of realism to it, most events evolve. Some may happen spontaneously. If a tornado goes through tonight, you have a live incident immediately. Probably tomorrow morning, people will start sorting out things. Something like a public health emergency, and hopefully someone isn't catching it tonight. Get into the Cipro right now. Doxy. It will evolve over a period of time. Something like this might evolve